One of the things that I love about acceptance and commitment therapy is that it's always growing. And the idea of choice point is a technique or an idea that Russ Harris explored and developed, I think, around 2010. His first version of his book, Act Made Simple, did not discuss this. It was introduced in the second edition of the book. And it's a really powerful technique. Now, it's designed as a technique to be educational, to actually be explained to a client. So I'm going to explain the idea of choice point for you. And as I explain it to you, recognize that this is how you can explain it to your clients. The great thing about ACT therapy is that it's educational. It doesn't just process things with clients, it actually teaches them something. Most of my clients don't do the unhealthy things that they do because they've decided to have a bad life. For almost all the clients who I've ever worked with, no matter what type of treatment setting that was in, whether it was seeing outpatients at the mental health clinic, inpatients in a mental health hospital, whether that's been seeing the well but unhappy people as a counselor in private practice, or as a professional hypnotist working with people to rise to their highest level and peak performance. I've never had anybody come to me yet and say, hey, I'd like to book an appointment and just talk to you about how I've achieved all my life goals. I'm living in a van down by the river. I'm thrice divorced. I keep warm at night by, burning rags in a 55-gallon oil drum. I've never had that person call me up. Instead, people call me up and say, I have a problem. I'm not where I'd like to be in life. Can you help me? Teaching people what they need to know in order to experience life differently is a hallmark, I think, of any successful therapeutic approach. Hypnotherapy, acceptance and commitment therapy, even insight-oriented therapies, I think, require education. So we can teach a client to look inside of themselves, that's called a transderivational search, and find the answers from within. So this technique of choice point in acceptance and commitment therapy is something Russ Harris has been teaching his patients that he wrote about in his book, Act Made Simple. It's something that I use with my clients and I teach it to them. I teach it to them with a marker board. For the last 25 years in my office, I've always had a marker board with dry erase markers, so I'm always ready to teach them something. And I think that teaching people, writing out on the board in a professor role is really helpful to some of our clients. So let me teach you choice point as I teach it to my clients. So imagine that you're my client, kick back and enjoy because your life is about to get better. By the way, notice that was a hypnotic suggestion. I say that to my clients, boy, I'm really glad that you're here. I want to teach you something that I found beneficial. Not only have I found it beneficial, but the many clients who I've worked with have found it beneficial. And I know that when I teach you about choice point, you're going to discover that you live your best life. So I'm really glad that you're here. I've already drawn it on the board for you. And that way I don't have to draw it while I'm also talking at the same time. But there are two arrows here. One is labeled towards and one is labeled away. I'll draw this on the board or on the piece of paper and I'll say to my clients, really when we're confronted with choices in life or even just experiences in life, because in every moment, in every experience, we have to choose a direction to go in. We can either go towards something positive, something healthy, something abundant, something resourceful, or we can move away into avoidance or into depression or into isolation or into negative and unhealthy habits. Anything from drinking and drugging to a harsh word or an unkind action. But we can go either towards something positive or we can go away towards something negative. Now, what causes us to do that? What causes us to do that is really being hooked by a thought or a feeling or a sensation or an urge or a memory or an experience of one type or another that we either choose to accept, that's where the acceptance in acceptance commitment theory comes into play, or part of where it comes into play, or when we have these thoughts, feelings, sensations, urges, memories, we ruminate, we regret, we feel a sense of unsureness. We get hooked. We second guess ourselves. We try to become avoidant, and we get hooked by these thoughts, feelings, urges, or memories, and we can't go forward doing the healthy things because we've been hooked by these unhealthy thoughts, feelings, sensations, urges. This is being hooked by the away ideas over here. How can we make better choices? There are two tools in acceptance and commitment therapy. There are many tools, but there are two that are primary. And first is about living our best life in a state of mindfulness. Mindfulness is where no matter how big our problems are, and no matter how big our problems have been, and no matter how big our problems might be in the future, as long as we're breathing, we're actually okay. The easiest way to eliminate anxiety or panic is to be fully in the present moment. Because at a basic level, as long as we're breathing, we're actually okay. And so I'm going to be training you and teaching you in mindfulness-based strategies. But in addition to that, of course, we have our values. What is it that's most important to us? I've included in this course, by the way, a script for a process I did in our Zoom meeting. That script is a basic process in values clarification. But one of the things that we need to do in order to live our best life is to act in congruence, in alignment with what our core values are. What it is that brings us a sense of freedom, what it is that brings us a sense of security, what it is that brings us a sense of significance, what it means to have love and to be able to love people in return, to have a sense of belonging. These are our deepest needs. A number of different authors, ranging from William Glasser to others, have talked about these as being really our core needs. And our deepest needs reflect our core values in life. And so during the process of acceptance and commitment therapy, I'm going to be helping you elicit your values so you'll know what's really most important to you. Values, of course, come in a number of different forms. It could be integrity. The idea could be resourcefulness. The idea could be independence. And acting in alignment and congruence with these things so that we can create a bubble of protection around us and act in a towards mentality. Those of you who are practitioners of neuro-linguistic programming and NLP, you've learned about the towards motivation and the from motivation. That idea actually in NLP predates Russ Harris writing about this in ACT therapy by probably 25 or 30 years. It has many common principles, recognizing early on that there are really only two directions to go in, and how do you help a client to then choose what they'd like to do. In this course, I'm going to be sharing with you a number of different techniques and some in-depth techniques to do this. One way to help a person with values is to simply ask, who are some of the people who you admire in life? When you think, who is it who you'd like to be like? You know, in the Alcoholics Anonymous program, everyone is supposed to find a sponsor. And of course, newcomers to the 12-step program say, well, how do I find a sponsor? And the advice that's given is usually find somebody who has something that you want. So let me ask you, who is it that you admire? Maybe somebody famous, maybe somebody in your family or your community. Who is it that you aspire to be most like? In different parts of your life, in different parts of our life, we probably aspire to be like different people. This is, by the way, another idea rooted in neuro-linguistic programming, the idea of finding an exemplar and replicating their success. What is it about that person who you admire that's really most important to you? Can we summarize it in a couple of words? What it is you value or admire about that person? Those are probably values that are inside of you. Now the question is, how do we act in a way that's congruent then with those values? We don't have to become that other person in order to be okay. We can become the best me I can possibly be by enlisting those values that I admire, respect, or acknowledge in the others who are in my world. We're also, of course, going to talk about mindfulness in depth in this course. In fact, the next two videos talk about mindfulness. There's a basic explanation of mindfulness at its simplest level. And then there's also a short practice. I'm going to provide both a video and an audio so you can download that to your phone and practice mindfulness so that you can begin doing what we ask our clients to do and moving towards in an unhooked way, a non-judgmental way, a detached way. Wouldn't it be nice? You have clients who've experienced trauma, but they're attached to that trauma. Help them become themselves rather than their trauma. Help a person become themselves rather than their pain. Help a person become themselves rather than their anger or their other unresourceful emotions. Choice point is a simple concept, but with profound results. Being able to teach clients these things really helps them conceptualize then what are the therapeutic goals. So that when I establish treatment plans and therapeutic goals with clients, they know exactly what it is they're aiming for.